So even ophthalmology clinic also for breast cancer, there's a more than 25% comes in the clinic with the breast cancer or colorectal cancer or kidney cancer, lung cancer, lymphoma, pancreatic cancer or blood cancer. Likewise, patient comes to our clinic. Then how to treat those patients? That definitely we will learn in those specialty practices also. Next one. Like in respiratory clinic, we can treat some patients of acute and chronic bronchial asthma or bronchiectasis. But in acute respiratory disease, what we have to do in eosinophilic lung patients, when diagnosed patient comes to us like interstitial lung disease, how to treat those patients with our proper medicine, or hypertensive pneumonitis, how we can go ahead, that we have to understand, and accordingly we should treat the patients. Then community acquired pneumonia or respiratory failure or pulmonary vascular diseases. There are so many other things, or like pulmonary hypertension, things are there where we have to take some special knowledge, and then we can treat the patient in to exactly what the way our is treating, and our clinical results of Ayurvedic medicines can be studied well. Next one. So there is a great range of results of medicine. In Ayurveda, generally Mutragata and Mutragucha, two types of diseases are described. But in allopathy, you can see chronic kidney disease. It may be due to diabetes, it may be due to hypertension, it may be due to polycystic renal disease, or it may be due to the uric acid nephropathy, or there are so many other things which are now sukshma differentiated, like vascular disease of kidney and MCDs, FSGS, then MPGN. There are so many other things which are diagnosis comes from the histopathological studies, progressive glomerular scleronephrosis, that we have to treat. Whether we give our medicines, it will produce some after good effect or after effect or bad effect, that we have to know. Then IgA nephropathy, then Alport syndrome or tubulointerstitial diseases, and our hemodialysis patients, whether we can go with Ayurvedic treatment, whether we can give Yapan Basti to the patient who is on dialysis, and whether it will help or not, that we have to study. And when we study those things, and when we give Yapan Basti, then the need of hemodialysis is reduced or maintained well. In some patients, they can be avoided. Likewise, things or observations, when we put, we can have a good results in our nephrology clinic also. Next one. In neurology clinic, like stroke patients, everywhere you can see in Ayurvedic clinics. But what kind of stroke was there? What was its classification? Then what was the risk factor for this stroke? What is his given, where exactly the location was the first stroke? Whether it is ischemic or non-hemorrhagic stroke was there, that has to be understood properly. Then we can give a clear-cut result to our patients. Then primary headache or tension headache or headache due to migrainal headache, this kind of headache we have to differentiate differently, and accordingly we should treat. Like peripheral neuropathy or disorders of neuromuscular junction or myopathy or GBS syndrome, that can be studied. And now for GBS syndrome, we can have very good results. How we can go ahead in those diseases, that we have to study further. And if we do these things in better way, definitely we can give good results after having a super specialty knowledge in our demyelinated case diseases also, and seizure and epilepsy also, with the proper application of electrophysiological studies or proper application of EEG studies also. We can see that our Gurutas or whatever the medicines which we provide, that we gives clinically better results to the patients. And in coordination with all other modern medicines, if we do, the dose requirement reduces quite considerably. Next one. Next one. Like in neurology diseases, there are so many other problems of the lobar dysfunctions like aphasia or dementia, then the Parkinsonisms, or you can see many patients of movement disorders. They're moving their means muscles, some specific muscles, their movement, hand movements will be there. Different kinds of body movements will be repeatedly they are following. For those diseases, now there is a means rather than butox, they don't have any specific medicines, where our panchakarma and other local treatments are very effective, like compressive myelopathy and non-compressive, that is a spinal part. If we go compressive and non-compressive myelopathy, for compressive myelopathy, how we should go and treat the patient, what kind of assurance we should give to the patients. In meningitis also, different kind of bacterial, viral, or you can say like encephalitis, whether we should treat cases this or not, that should be decided. Then the disease of cranial nerves, that should be decided differently. And for the nerve palsies like specific Bell's palsy and like that, if we can have good results, definitely in these specifically clinics we can collect the data and we can give good results. That's why a super specialty is needed, because we know what we are treating, how we are moving ahead, how we are progressing to the disease, and what kind of results in terms of percentage we can achieve in those persons due to this specific experience. So everything, when we know the specifically how we are going, we can assure the patient in the better way. And if you assure the patient and the assured results are there, people are happy with the pathy. Next one. So in endocrinology, that is the most common problem, like that hyperthyroidism, thyrotoxicosis, diabetes, bone and mineral diseases, osteoporosis. This is the more great increasing disease now. We have to treat this osteoporosis very aggressively. Then prolactinemia, Cushing syndrome, pheochromocytoma. These are the patients now they are coming or referred for they come for the Ayurvedic treatments also. So we have to see what are the treatment results of our Basti treatment, or whatever the Vaman, Virechan treatment or Panchakarma treatment, what we give on these diseases, that data we should collect and we can predict in specifically. Then we can give specifically a protocol, or you can have that SOP for that specific treatment prepared, and accordingly we can give means specific results in those patients, where the doctor will not be in a dilemma whether this patient will be cured with our pathy or not. That dilemma, which is after even doing chikitsa, sometimes there is always in the mind. So sometimes after doing Kai Chikitsa, there is always a question in the mind, what should treatment I should do? Sometimes whether it will give result or not, that confidence is generated in the patient's and doctor's mind with the help of this super specialty knowledge. That's why super specialty is needed. Next one. Like most commonly, all gastrointestinal patients comes to the Ayurvedic clinic, or patients comes to our clinic, like inflammatory bowel disease or malabsorption syndrome, celiac disease, short bowel syndrome, or irritable bowel disease. So after getting the diagnosis and a proper treatment, if we have the tissue diagnosis as well as clear-cut diagnosis of the patient, and if your medicines are working this year, you can pick a standard protocol for these treatments, and that protocol will help us to give confidence to the new budding doctors to go and treat these patients worldwide, and definitely you will have the clinical disease up to this and this percentage. No matter if the treatment gets results in 30, 40, 50, 60 patients. Now the patient treatment which is having most success in clinical practice is infertility treatment. That is having success only 30 to 40%, even though all over the world infertility clinics are there. So if Ayurvedic treatments are getting 40, 50, 60, 70% weightage, that is a good ratio, but just get it documented and start in a like a institutional way. This is going to be the future of modern, going to be a future of the integrated Ayurvedic and modern medicine. Next one. Hepatology clinic, specifically in disorders of bilirubinemia, then acute and viral liver failure, acute viral hepatitis like A hepatitis, B hepatitis, C hepatitis, D hepatitis, E hepatitis, what should be given? Likewise, alcoholic liver disease, these are the common, mostly visit all these patients, definitely visit Ayurvedic clinic also. But in those patients in ascitic stage, how we should treat them? In hepatic encephalopathy, what are the do's and don'ts? What are the things given in our text, and what are the treatment which will help him to get the good results. Like his serum albumin levels are decreasing continuously less than 2, then these patients generally are posted for liver transplant. So with the help of early diagnosis and treatment, we can reduce the help of liver transplant. That is a burden on patient and society that we can reduce with the help of Ayurvedic disease. So this kind of specifically hepatology clinic is also need of the hour. So please take interest in those diseases and have a specific knowledge about all these things. Be focused for getting the knowledge on these things, and then definitely you will have a successful clinic on these diseases. Next one. So rheumatology and immunology clinic. So it is a bread and butter for Ayurveda. All arthritis patients definitely they come to the Ayurvedic clinic. So rheumatoid arthritis, spondyloarthritis, or like vasculitis or SLEs, they do visit Ayurvedic clinic and they really have very good results. Even in systemic sclerosis or MCTD patients, mixed connective tissue disorder patients also, or polymyositis or like that patients also, inflammatory muscle disease also, really very good clinically results are there. But for their diagnosis and everything, if we do systematically and do keep the data of all these ANA positive, ANA negative, which kind of ANA was positive and whether that has been cured or not, that kind of treatments definitely will help us to cure all these patients. So we need a special knowledge of all these systems and what kind of medicines prescribed in this specific cases of Ayurveda, like SLE or other diseases, we can combine with the Vata Rakta, that kind of treatment in Rodent disease. In rheumatoid arthritis, some different kind of aspects that we should have to do. In vasculitis, in the Pitta Chikitsa, like what are given, that kind of Chikitsa or Shotha Chikitsa that can be applied. So different kind of medicines which are explained in Ayurveda can be used beautifully in these patients. Even the drugs like Suvarnabhupati or Siddhamukarduvati you give, that works as a disease modifying drug for all these rheumatology patients. So likewise, whatever they are standardly given to the patients, that methotrexate, steroids, painkillers, or chloroquine, which is given to the patients, and due to that they are getting hepatotoxicity, ototoxicity, or sometimes retinal toxicity also on these chloroquine taking patients, which is happening, that also we can reduce with the help of Ayurvedic patients, and we can maintain the range of movement of the joints of the patients. Then we can check the inflammation, pain, and stiffness of the patient in a better management way with the help of Panchakarma and Ayurvedic medicines, where rheumatology and immunological clinics will have a tremendous success in those cases. So, but we have to be focused, we have to be get documented evidences, and accordingly we should collect those documents togetherly, and then we can go for the betterment of these diseases, and we can provide a good and quality results in those patients. Next one. So orthopedic, this is also bread and butter for us. So any knee joint patient comes to us, then we always see that yes, okay, this patient is Sandhigata Vat, and we treat this patient like as a osteoarthritis. Then definitely we should come to know this super specialty practice. If he is having ACL injury or MCL injury or PCL injury, or whether he is having some other injuries like that, if we know these things after MRI, we will come to know the thoroughly anatomy, which part is getting damaged, and after treatment, whether we are able to heal those things or not. That is to be studied properly, and what are the results of our treatment, that is to be documented. Not only just diagnose the Sandhivat, he is having the I am doing Stan Sweden, but which oils should be used in ACL, which oils you should use in meniscal injury, that is little bit different, because the aspect is different. Where the snayu, then the treatment will be different. Where the fibrocartilage is involved, the treatment will be different. Where bone is involved, then the treatment will be involved. When the synovitis is there, then the treatment will be different. That's why definitely sometimes we cannot give a conclusive means commitment to the patient that yes, you will get cured with these medicines or not, because we don't understand these things internally correctly. So when we understand through this specialty courses that everything is clear for us, then we can treat the patient with all the existing parameters, and definitely we can give good results. In spine disorders, there's a tremendous very good results. Means 90% of spine surgeries we can avoid with the help of Ayurveda. Only with the Sneha and Swedan, Basti and our treatments, different kinds of patients which are having definitely all spinal canal compression or compressive myelopathy, non-compressive myelopathy, even the disc bulges are there or not, or whether there are some bony changes or not, whether the osteoporosis of the spine, all kind of spine disorders. Definitely this you should take home message. If you treat spine well, definitely you can give good results to patient, and 90% of surgeries of spine can be avoided with the help of only the traumatic conditions needs to be spared. Otherwise, all other spine conditions can be treated well with the help of Ayurveda. We have got more than 1.5 lakh patients of spine, and they have very good results in those patients. So anybody want to start the spine disorders, he should join this course, and definitely he will have good results. Likewise, in frozen shoulders, vascular necrosis of head, the grade 1, grade 2, grade 3 can be treated well. But when the uh, uh, of the means femoral head is involved, and there is one more than one third bone is necrosis is happened, then only we have to post for the surgery also. We are never against the surgery, but at right condition, at right time, we should refer to the patient, and other conditions can be treated medicinally well. Even in spine disease, it is said that for 6 weeks you should treat the patient specifically on the clinically, and with the clinically he doesn't get any result, then he should be referred for the surgery. But within 6 weeks, if you treat the patient, definitely in all these kind of patients you have a very good results. With gout or polyarthritis or post-viral arthritis like chikungunya arthritis, people don't get good results in allopathy also. So if you understand, okay, these patients can be treated well with the Abhyanga Shashishali Basti, definitely, but it is to be documented which kind of pottery, which kind of oil, in which condition we should use. That is a special knowledge of Ayurveda that you will learn in these super specialty clinics. Next one. Dermatology. Most of the patients, they also come to the clinic in the chronic conditions. In acute conditions, they may visit allopathy clinic, but all chronic conditions of eczema, psoriasis, vitiligo, dermatitis, herpes, or cosmetic problems, or like butterfly rash on the head. So all these patients, acne, all these patients will come to the specialty clinic for Ayurvedic treatments, because we have very good results in all these treatments. So we have to understand the type of eczema, which are as per the dermatologist says, we should understand on what kind of disease we have treated, what kind of medicines we have given, take a proper documentation of it, and then we will be able to whether Nimba is to be used, whether to Khadir is to be used, whether Snehapan is to be used, whether Snehapan is not to be used, all these things, whether Virejan is to be given or woman is to be given, that can be a discussion for you. So this is not whether you are going to treat this patient or not. You are going to 100% give results to the patient, but which one is better? Whether the woman with Mahatikta Ghrutam is better or whether with the Kalyana Ghruta is better, that is to be point we have to study. We are going to treat the patient and we are going to means give good relief to the patient symptomatically. But which one is better? Which one is faster? Now that kind of correction we should do in all our patients, and definitely then the patients will have good faith in Ayurveda and believe in Ayurveda, and definitely after seeing the results, patient will comes to us. Seeing is believing. When the patient sees that whatever my complaints were there, whatever my treatment was there, my skin was ready, and now I am having a full skin, non-healing ulcers were there, now all the ulcers were healed and eczema is now properly healed, then only patient gets good relief. There are so many psoriatic patches and now no patches on the skin, then the patient gets good relief. But we should know them, ask them that yes, recurrence is all possible in all these diseases. So to avoid recurrence, you have to take this rasayan therapy or for that other chikitsas also, and you have to continue the panchakarma or like follow for that, so that the recurrence will not be there. So for the recurrence also, and for the its clinical presentations also for these medicines, we have to be have some specific protocol, and that the result chart should be there. Next one. So infertility clinic for male infertility, there are so many patients now coming to the Ayurvedic treatments for increasing low testosterone levels, or likewise super specialty cases from referred from infertility hospitals like Indira or Progenesis, and so many other infertility clinics, patient referred to our clinic for having DNA defragmentation conditions. The patients who is having sperm DNA defragmentation more than 60, 70, 80%, and which are not treated with other medicines, with Ayurvedic medicines, within a span of 3 months, that can be reduced to more less than 10%. And that is the good results we are providing to our patient. In those patients, specifically, we can have. So we should know which kind of test we should do for patients, and that one gives us clinically very good results. If Sertoli cell syndrome is there, what should be the treatment in oligoazoospermia, complete azoospermia, or in obstructive azoospermia, in unobstructive azoospermia, what should be the treatment? That is a special knowledge we have to take. Likewise, in female infertility also, whether it is an ovarian problem, tubal problem, or uterine problem, that has to be studied. And likewise, hormonal problem, whether it is having hyperprolactinemia or not, FSH, LH, all these levels, and with the Ayurvedic treatment, with these levels are balanced or not, whether we can increase LH level or not, if insulin resistance we can decrease or not in PCOD patients, like that, which is the most prominent cause for female infertility, that can be increased. Even due to increasing stress, pain, and lifestyle disorders, there are some problems in intimacy of the couple also that can be easily solved with the help of Vajikaran Chikits also. Then EDP, all these things are very common in your clinic. But with this super specialty knowledge, you can have better results in all these kind of patients. So whenever there is a patient of Majja Dhatu, Mausa Dhatu, Meda Dhatu, Shukra Dhatu, Asti Dhatu, all Gambhir Dhatus, non-infective diseases can be treated well with the Ayurvedic treatment. You can give 90-95% guarantee to your patient that yes, your symptoms will have good results in all these stages. Don't give them that we will cure this disease, but we can have a good relief with all Ayurvedic medicines in all these Gambhir Dhatus. Rasa Rakta Dhatu, sometimes due to infective conditions, we have to treat allopathy, or we have to take support from those symptoms. But other patients, in all these other patients, definitely all these Gambhir Dhatu, Meda, Maus, Asti, Majja, Shukra, definitely Ayurveda is a choice of treatment, and in future you will see that for all these diseases, the Ayurvedic protocol will be followed throughout the globe. If we provide them evidence-based results, then only we will be able to take Ayurveda globally, and then people will learn Ayurveda, and they will also teach us what are the good things in Ayurveda. So we have to practice it. We have to be more precise. We have to take evidence based. We have to take all this data with the help of AI, with the help of all the data collecting systems which we are giving, or diagnostic modalities which are now ever expanding. And with all these results, definitely we will have good results in all of this super specialty knowledge. We will have tremendous results, and that is expected by the that is expectation of the society, that Ayurvedic doctor should give a committed result to their patient. He should not be whether result will be there or not be there. Yes, this much result should be there. That is a commitment to the society should be there by the doctor, not only regarding the prevention, but for the curative aspect of the disease also we should give commitment, and it will come through the super specialty knowledge only. So be ready to get this super specialty knowledge, and then only you can treat your patient. Definitely we will have a very successful clinical rate. We can satisfy our patient well, and when we can satisfy our patient well and give clinically results, everybody will respect your pathy, everybody will accept your treatment, and there will not be no any questions on your pathy. If they are, we can give the results. If chemotherapy having some bad effects or after effects, people will accept chemotherapy. Even there are some ill effects of Ayurveda, even there are some side effects of Ayurvedic treatment, people will accept us that also. But we should explain them in first. If you tell them first, there will be a confidence in the patient's mind. And if you tell them afterwards, no, no, this may happen with her, they will always have a doubt regarding you. So be first, get the knowledge and then do the perfectly implementation of your knowledge. Then definitely we will be successful in treating the patients in a better way, and the flow of the patients in your will be clinically come. You should not depend on the digital marketing. You should not depend on other marketing tactics for your practice. But result is the only marketing strategy for your patient, which will fetch next patient to you, your clinic. Because that is the most common tradition in India. If you give results, the patient who got the result will bring next 3 patients, 4 patients, and that patient comes with faith, not with doubt. The patient with digital marketing come in your clinic with doubt, but with the results, the patient which is referred, he will come with the confidence, and with the confidence and belief or bhakti in your treatment, definitely he will give good clinical results, which can be shown in histopathological reports also, or in his hematological results also, or you can see radiological results also. All these parameters, or you want to see in nuclear clinical medicine also, you can observe this. We have got so many patients whose renal GFR is increased in DTPA renal scan. If you do, that has maintained well with the Ayurvedic treatments. It is not reduced in so many years also for diabetic patients also. So our medicines do not provide defects. We can control those things also, but it is to be proved. It is not good that as I am holding this. Puranam iktevana sadhu sarvam. Na janapi navkitya vadyam, which is new, that is very good and gold standard. It is not like that. And it is as it is a old, it is not gold. It is also not bad. So we Purana Parikshatera sadhu manyante means you have to do proper examination. You have to be a third umpire, see the things in all and each and every context with all pros and cons. You should examine the thing and then accept or hold which is truth. What is truth? That is accept the result, and then you should go ahead. And I am confident that Ayurvedic treatments are very good in all these treatments in our places. So how to make these things useful to society, and how you should do these things useful to your patients, how patient will directly come to the give priority for any treatments, that depends on your knowledge and how you counsel your patient. That is, and that's why we need this Jnana Buddhi Pradip, which can be achieved through these super specialty clinics. Next one. So in pediatric clinic also now, though so many patients come with the autism or respiratory disorders, so that is the bread and butter for pediatric clinics. And that can be tackled well with the Ayurvedic treatment. If you do simple medicines for those patients, then their digestive disorder, cognitive disorder, height, weight, growth, and all other problems in pediatric and geriatric, we are the masters. But people have always fear in their mind whether where treatments will work or not, if any emergency comes or not. Then only that fear in the physician's mind is the obstacle for this practice growth. So we should remove this fear from our mind, and we should take good experience. First, we should take technical knowledge, clinical implementation. At least results in 100 patient is to be studied, and after that, if you start doing it, definitely you will have a successful clinic. Without experience, if you start on the technical or theoretical basis, or somebody says that this gives a good medicine, this is a good medicine for this, and I will use this oil specifically for psoriasis, and now I have given and then I don't get the results. This happens that Sukshma Samikshesham we have not studied properly. So most of the times our results represent our knowledge. Why we are not getting results? Because our knowledge or depth which is given in Ayurveda, that is more. So we have to deep dive into our clinical text, our Sanhitas, our textual knowledge. We should increase. We should go through the Rasa Shastra. We should go through the all our given Nigantus, and then we can bring that Amrut to the patient. As Dhanvantari given Amrut Kalash like that, you should provide society the best medicine, that is called Amrut, for that patient. Next one. So in ophthalmology clinic also, now people will able to see will this retina also, some retinic problem also, diabetic retinopathy, other problems also, that we can treat well with our treatment, like corneal ulcers, retinal detachment, or macular degeneration patients. Now with Snehapan and other medicines, there are so many patients in our clinic. They have given good results. We have studied it with the Shankarani Praluknan as doctors also. We check their reports, and these patients definitely get good results with that report. But it has to be studied properly, and simple prescription like Yogendras can give us good results in all these medicines also. Like Mahalakshmi Vilas are getting good results in all these retinopathy patients also. But we have to understand how these medicines are useful, why these medicines are good, that 5W and 1H, why, what, when, how, that should be understood in this super specialty clinics. So when we have answers of 5W and 1H, definitely we can proceed further with confidence. We are not only यथा खरश्चंदन भारस्य वेदांतोच्चन्दस्य एवं ही शास्त्राणि बहुनि अधत्य चार्थेषु मूढा फरवदन्ति. Like we are doing Vahan of Ayurveda as without understanding the proper crux of it. But we can understand that crux with the proper application and understanding of this anatomy and physiology and pathophysiology of the disease. We can apply Ayurvedic medicines to all these conditions in a better and systematic way. Next one. So in the modern bioin clinic, this is the now trending stage, according to these are trending clinics everywhere for psychiatric treatment. Now people are following and preferring Ayurveda. So there were some mind and body problems are there everywhere. You can apply Ayurvedic principles. You have got good results. Next one. So our ultimate aim is ultimately we want good clinical results and become a patient happy. For that, we should have a thoroughly understanding of this knowledge from the perspective of Ayurvedic text, from the perspective of allopathy knowledge or anatomy, physiology, pathophysiology, and everything which we understand. Likewise, rightly said by Charak, pratyaksha karanena cha, aptopakarena cha, like that, we should understand the thing perfectly. Aptopadeshena cha, pratyaksha anumanena cha vyadhin samyak vidyat vichakshana. So if we want to be vichakshan, before knowing all these things, so what is given by Charak, like wise in all this super specialty, we should understand Rokam Ekekam Evam Prokopanam. What is this Prokop? Hetus are there. Evam Yonim, Evam Utthanam, Evam Atmanam, Evam Adhisthanam. So it's Purorup, Rup, Samprapti, Upashay. That everything we should understand before treating the patient. Evam Vedanam, what will be the happen in those, what are his types? Evam Samsanam, it will proceed in body in this specific way, like Evam Shabda Sparsha Ruprasa Gandham. If it is happening, that we should do. So if we are getting all these things, definitely we will have good clinical results. Yes, sir. Okay, तस्मात् एवं वृद्धिक्षाय समन्वितम एवं उदरकम एवं नावानम एवं योगम विद्यात. These are the all the spectrum for any disease. If you want to start special practice, what are the things that we should study, that is specifically given in Charak Vimanstan, like that fourth adhyay in sixth stanza. So accordingly, we should go this Rokam Ekekam evam namanam evam yogat, and after that we will come to know तस्मात् इयं प्रतिकारार्थ प्रवृत्तिर अथवा निवृत्तिर इपि उपदेशात् ज्ञायते. So with the Aptopadesh, we should get all this knowledge from the existing, whatever we are having our Google knowledge or whatever text knowledge from Ayurveda or allopathy, we can collect and all this Ayush system, and we should collect those knowledge, and what things which will give good results to our patient, that should be implemented in our patient, so that they will have good clinical results, and there will be no the recurrence of the disease, or remission and relapses we can be avoided in those patients. So like this, all this disease we should focus in our getting thoroughly knowledge. Next one. So likewise, everybody has Dhaneshana, Praneshana, and Paralokeshana. So Praneshana can be fulfilled anyway, but your Dhaneshana depends upon your knowledge and how implementation of your knowledge. If you get specialty knowledge, if you get general knowledge, if you get super specialty knowledge, your Dhaneshana will be fulfilled. And if you treat your patients well, they will give you, you can get accumulate more punya in your account, and then Paralokeshana or moksha can be easily achieved. Next one. So likewise, you be like Arjuna, you don't see the things, you get more focused on your target, what you want to learn, what you want to achieve, what you want to get in your future. If you want to be specific, you have to be. If you want to be a fly into the sky, don't get practice with the ducks in the water. You have to do practice with eagles, then only you can fly well. Likewise, you be target oriented, you get a target like Arjun and have a proper Lakshaved for that. Then only you can be a multi-millionaire practitioner, successful practitioner, super specialty practitioner with the help of this. That's why Arjuna has required Dronacharya as Gurukul. You will require some specific Gurukul for this. So be connected, stay tuned with the Gurukul notes, and be a student and get the good knowledge from this Guru. That's all. Now this session is open for questions and answers. If you have any query, I think in the stipulated time which was given to me, I have given all the examples to you. For that small technical glitch, you can pardon me. Thanks you. Thanks a lot, and thanks Gurukul for giving this opportunity to communicate with you all in this wonderful session. Thank you. Thanks a lot.
Thank you, sir. Now we are moving to concluding session. I request to Dr. Nayan for the vote of thanks.
Thank you.
Good evening, everyone. Myself, Dr. Nayan Untawale, as a core team member and on behalf of the Gurukul Global Academy and Parasnath Foundation, I take this opportunity to sincerely thank all those who have made today's session, especially a special program, memorable. First and foremost, my heartfelt thanks to our esteemed guest, Dr. Shubhangi Parkar, for gracing this occasion and inspiring us with her presence. A special thanks to our speaker, Dr. Sunil Damdar sir, for sharing such deep insights on the scope of Ayurveda in super specialty practices. Your words truly opened new horizons for all of us. I also extend my gratitude to our in charge, Dr. Bapardekar sir, for his constant guidance and leadership, and to Dr. Pratiksha Patil for gracefully introducing the session today. Our sincere appreciation goes to our founder, Dr. Bhalchandra Mahamuni sir, whose vision and dedication has made such platforms possible for the Ayurveda fraternity. Also, behind every smooth event is strong technical support. Thank you, Mr. Yash, for ensuring everything ran seamlessly online. We are also thankful to Ayurveda institutions, Ayurveda brands and organizations, and Ayurveda listeners like you for making today's event successful. A warm thanks to all participants who have joined us today. Your presence and involvement makes these discussions truly wonderful. With that, I once again thank everyone for being part of today's program. Let's carry forward the spirit of Ayurveda and to work together to build a future of healthcare. We request you all to stay connected in the WhatsApp group so as to get the links of upcoming clinical meetings. Thank you so much.
Thank you. I conclude today's session. Thankful to sir and all our members and all our speakers, guest speakers, our guest of honor and all the staff. Thank you. I request all to be connected with the Gurukul Global Academy through WhatsApp, email, and social media. Thank you. Thank you so much.